The program is now live from the Element Well studio. We're pleased to welcome now Quentin Whitwell, CEO of Progressive Heath Group. Hey, Quentin, how you doing, man?
Hey, Gerard. Good to see you, my friend.
Same here. So we wanted to have you on to give us an update. Hadn't spoken to you in a while on the state of the healthcare, specifically the hospital industry in the state of Mississippi and across the nation in general. What are you seeing?
Well, I'm very pleased to be with you. I was very fortunate to have the Mississippi Business Journal cover my story, Embracing Change, this past month. And that's what I've been doing since I left Jackson, is embracing change, and got the opportunity to be involved in rural hospitals as a lawyer, and obviously having government affairs and policy experience, and over the last few years have been fortunate enough to have my own company and to be working in these rural communities. And I just feel like they're the lifeblood of rural, what it means to be rural. If you don't have a decent school system, don't have some financial institutions, don't have health care, these places cannot grow. And what I see with our state specifically, our governor has done a very good job of recruiting industry, economic development. We've seen some towns like over in Arkansas, for example, Helena, Arkansas. They have a huge port industry that they are growing to the tune of billions of dollars. And without a hospital surviving there, they would not be able to recruit those industries. We were able to take the Houston, Mississippi hospital and acquire it and reopen that emergency room. I know there's a national story where a lady actually went to that hospital thinking she would be seen at an emergency room. It had been closed for over a decade, but she had no idea, and she died there. And now that emergency room is reopened. And those are the kind of success stories that make us proud for what we do. We're very thankful to be in other states, and in Georgia specifically, and we're growing there, and also in Texas, and looking at other states such as Missouri. So we're very pleased where we are as a company. There's always bumps along the way. There's challenges. Obviously, we all have our thoughts about the way that healthcare should be implemented and what should be done with our commercial payers and with the federal system, whether it be Medicare, Medicaid, administered at the state level. But having a good payer mix is important. But at the end of the day, when you work in these rural communities, you have to be lean and mean and understand the rules and regulations that are in place, and make sure that you provide good health care. So that's what we try to do. Obviously, there are a lot of struggling hospitals. Most of the ones that are left independently are like county owned or hospital authority owned. There are very few like us that have, a footprint of several, or they're the big guys that have many, many hospitals. But a lot of those companies, to clean up their balance sheets, are shedding hospitals right now. And that puts them dangerously teetering on the line. There's even a big bankruptcy case going on where Steward Healthcare, it's over $9 billion in assets that are in bankruptcy right now. And we've been watching that very closely as well.
Yeah, I've been watching that as well. I get news about it from the Boston Globe. They operated a number of hospitals in the state of Massachusetts. I believe they're Florida-based, if I'm not mistaken, but had a bunch of hospitals in Massachusetts. And I think there's some lawsuits going on in the state of Massachusetts against Stewart right now for the way some of that was handled. I mean, that was fairly abrupt.
Oh, yeah. I mean, apparently, according to news reports, the CEO was living a very lavish lifestyle, up to $250 million a year, which certainly does not help his cause. The Attorney General of Massachusetts was very frustrated with some of the things that were happening to some of their larger systems that Stewart owned. I think a deal has been struck where Medical Properties Trust, which is a huge REIT out of Birmingham, actually took control over all of the operations
Wow.
of where they own the properties, and that's going on. Um, and we're very good friends with the Pafford Ambulance System Group, and they are out of Hope, Arkansas. They're in the middle of trying to get that hospital back over there, and we've been looking across the Texas border over there at Texarkana and what's going on there, because there was a huge brand new facility being built by Medical Properties Trust, and what's going to happen with that will be interesting, given that Texas does not have CON laws like Mississippi does.
Speaking of that, Quentin, there was an attempt, there's been multiple attempts to at least reform, at a minimum, the certificate of need legal structure, statutory structure in the state of Mississippi. This past year, there was a measure that passed the House, got into the Senate, died in committee, that would have at least reformed it to some extent, some specific service categories. I think mental health was one of those, for example. I think we're going to see a push for that again in this coming session. Where do you stand on that?
Well, I have mixed views, Gerard. One of the things that I think about as a person that is acquiring assets both on the real estate side and the operation side, we look at our certificate of needs as an asset. And so when you dispose of an asset and just allow full free market for without any protection, sometimes that can cause unintended consequences. However, I do believe that at the same time, of course, in a free market system, you would allow uh, different entities who want to do things in different environments to be able to do that. For example, ambulatory surgery centers. A lot of these surgery centers are popping up, and outpatient services tends to be the wave of the future. But also these small rural hospitals, that's the way we survive, is having an OR, having outpatient surgery in the hospital. And so we like the fact that we are able to be the one that is bringing those services in those areas. Where we are primarily in rural areas, I don't think we are too worried about some major entity coming and building a big, huge hospital in Houston, Mississippi, for example, or Marks, Mississippi. But I do think we need to look at these laws. I think mental health is the best place to start. I had a bill out there for these rural emergency hospitals to be able to continue some level of inpatient psychiatric care that I think needs to be dealt with. I was hoping it would be dealt with on the licensure side and not even worry about the CON side, since that is such a hot potato, and we're going to look at exactly where that will be next year. But I've also spoken with Dr. Daniel Edney, who I think is a ferocious leader for our state and has done a great job working with all the systems, whether they be small, county owned, larger, just looking at the landscape of our state and the services that are needed. And I think he's going to provide a lot of guidance there.
Quentin, you're aware that the state applied for and received waivers from the federal government to reform the Medicaid payment structure. That's infused a fair amount of money into hospitals. Do you think that's been beneficial to the hospitals in Mississippi?
It's been tremendously beneficial. I will be honest, I was one that was very skeptical about whether the approval would occur, given that we were doing one side of the aisle and not the other.
Yeah.
I'm very thankful to the governor for applying for it and for receiving it. Um, the formula is very interesting in the way they do it, and we have people internally trying to fully analyze and understand exactly where the funds come from based upon certain services. I think a lot of the hospitals that still do OB are getting the largest benefit from that. As you know, obstetric care is really difficult in a lot of places, especially in the Mississippi Delta. So those hospitals that are able to continue that I applaud them for that. Um, for us, some of our hospitals got more than others, but we've been able to utilize that to do a couple things. First of all, clean up our own balance sheet with vendors and payments that we owe or have owed traditionally to people, and also expanding services. We have a tremendous partnership now with the GI Group out of
Gotcha.
Oxford, who are doing their surgeries in Batesville, Mississippi. And we've also established a cath lab wherein uh, we are salvaging limbs that otherwise with diabetic
Wow.
patients and others are at loss, of potential loss of losing those limbs. So
We
we're
got
able
to
to do a lot
go.
of good things with.
Appreciate it, Quentin. Appreciate your expertise and your insight. We'll talk again soon. Thank you, man.
Thank you, sir. Good to see you.
Yeah, man.